Hi everyone, I'm Dr. Hiro. Today I'd like to mention about EAT, EAT. EAT may remind you of something yummy, but it is short for Epipharyngeal Abrasion Therapy. Epipharynx is located in the upside back of the throat, the root of the nose. Epipharynx can be the gateway to variable complaints. Some of these are associated with long COVID. EAT has been originated in Japan in 1960s. After 2010s, the endoscopy has opened the gate to the diagnosis and therapy of the chronic epipharyngitis. You may be suffering from these symptoms. Complaints around the neck, cough, loud snore or sleep apnea, post-nasal drip, fatigue, insomnia, headache, stress, loss of eagerness or concentration, and so on. People consult many doctors and be told that no apparent cause of disease. The medications would not work well enough and the doctor shopping goes on and on. There are epi, middle, and hypopharynx. Only the epipharynx captures the viruses, bacteria, pollen, and PM 2.5. Thus, for the COVID-19 PCR, best sampling venue is the epipharynx. When water comes in, epipharynx aches because it functions as an air filter. The air through the nose is filtered by nose hair, humidified and warmed by nostrils. Then the air becomes ideal for letting into the bronchus and the lung. If you breathe air through the mouth, not a few percentage of the dry and polluted air would be reversed up to the epipharynx. Then an air filter in the epipharynx will clog up. After that, the mucus is secreted for cleansing the clogged air filter. The mucus is noticed as running nose, but if it downflows to the back of the throat, it is felt as the phlegm. Epipharynx locates back to the hypothalamus. During chronic epipharyngitis, some inflammatory cytokines may confuse the vagal nerve in the hypothalamus. That's the reason why the various diseases throughout the body would be triggered by chronic epipharyngitis. We call the epipharynx as the terrorist camp. The inflammatory cytokines from there would also migrate in the bloodstream to the whole body, then turns out to be a number of triggers to various diseases. Now, let's check out your breathing style, through the mouth or through the nose. Close your mouth and feel where's your tongue tip. Is it in the back of your front teeth? If it's so, you breathe air through the mouth. The ideal position of the tongue is at the upper jaw, just like supporting the head gravity, and to shut the oral airway to help the nasal breathing. Since 2014, I have examined the epipharyngeal endoscopy. Diameter of the nasoscope is 5.9 mm, almost the same thickness as udon noodle. In normal epipharynx, you can see blood vessels directly under the mucous membrane. As the inflammation progresses, veins become invisible and the membrane will get swollen. With a cotton swab soaked in 0.5 to 1.0% zinc chloride, we abrade the epipharynx. The epipharyngitis membrane would easily bleed with the abrasion, but normal membrane would not be bled. The tapping technique to the back wall of the epipharynx stimulates autonomic nervous system in the hypothalamus. Before EAT, the endoscopy is desirable to rule out the fragile vessels or the cancer and etc. The endoscopy specifies also the exact inflammatory location for the effective EAT. patient satisfaction score shows rather than satisfied or better, but it may depend on the abrasion skill. Only after we know the endoscopically specified location of epipharyngitis, the blind EAT would become much effective. The chronic epipharyngitis is a self-treatable disease. We recommend 4 methods of self-care. Number 1. Training of the tongue and facial muscles to keep the tongue position at the upper jaw. 10 sets of R, E, O, Bay exercise 3 times a day may shape your face line small and sharp. Tongue is the most muscle-rich organ you have. It surely works. Number 2. Rinse your nose 2 times a day after you back home and before you go to bed. It helps easier nasal breathing. Number 3. Mouth taping after nose rinse before you sleep. And number 4. Green ume extracts or mistletoe. Drip them to your nose to heal epipharyngitis. EAT still has not been popular in Japan even among ear, nose, throat doctors. In 2022, 2 original papers proved that EAT could be one of the effective therapy for long COVID. These are quoted by the authoritative Nature. I'm also nominated as one of the co-authors. EAT may become a torch of new medical approach to various diseases. In our clinic, during the transnasal gastroendoscopy on the way to the stomach, chronic epipharyngitis will be automatically diagnosed and EAT will be performed simultaneously. A number of patients suffer from the chronic epipharyngitis without recognizing. It's a pity to hear that lots of patients are told you have no treatable diseases. All the mammals breathe through the nose, but only human can breathe through the mouth. Human breathes 20,000 times a day. The mouth breathing may trigger a variety of undesirable diseases by the same degree. Thank you for watching this video. See you next. Bye-bye.